Hello and welcome to YouTube channel Health Cube, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. In today's video, I'm going to talk about post-surgical care. Yes, I've seen so many people who go through surgeries. It could be a surgery after breast cancer or even any other sort of surgeries, are scared to move the limbs around it, are scared to mobilize their scar tissues or else their suture areas, and due to that fear sometimes they develop fibrosis. Now, what is fibrosis? How to take care of that suture area in a way that you don't land up into pains and aches, and how to mobilize your scar. We are going to discuss all of that in today's video. So make sure to watch this video till the end if you who are someone who has undergone any surgery and is trying to understand more about it, or else if you are planning to go through a surgery. Let's get started. So friends, surgery, a scary term, right? There are so many types of surgeries that happens or that can happen to our body, right? Certain surgeries are elective. When I say elective, they are not very serious, or you can say you can opt for your date and you can go through it. And then there are some surgeries which are done in emergency scenarios, right? Now, all these surgeries are critical for our recovery process or else our well-being. That's the reason you're going through it, right? Now, apart from surgery, the post-surgical care is equally very important. So I'm not going to mention any typical type of surgery, but I'm going to talk about some do's and don'ts and some care tips that applies to any post-surgical case. Mostly I would highly recommend that you share this video with your doctor or else a physiotherapist who is taking care of you post surgery, and get a guidance and go through that, because it's very important to take care of your mobility. It's very important to take care of your physical functioning post surgery so that you can recover back to your normal life as soon as possible. So whenever the name of surgery comes, there is a pre-operative care, there is the operation that you go through, and then there is something called as post-operative care. Now, the idea of post-operative care is to make sure that number one, all the possible complication that can happen post surgery can be minimized or prevented. Second idea of post surgical care is to make sure that the patient recovers from the sutures, incision, or any procedure that is done. That thing heals completely, so patient reaches to that healing stage. And the third important thing that comes to post surgical care is recovery part or rehabilitation part, where the patient retrains himself and come back to its original or else the day-to-day lifestyle. And in all of these three processes, it's very important to have physiotherapist by your side, because he can guide you, he can be your coach in your recovery process, because they are first medically educated, they know the surgery process, they know the do's and don'ts, the importance of early mobility and all the things that are involved in post-operative care, and they can work in collaboration with your doctor to help you to recover as fast as possible. Hence, it's important that if physiotherapy is advised to you, please don't ignore it. That is going to help you to get back to your life as soon as possible. Having said that, the first tip that I would like to give you about post-surgical care is doing breathing exercise. That's the basic of any post-surgical care, or I would say in general for our health and well-being. The amount of air that we inhale determines the oxygen that goes in your body. Your oxygen levels are very important for your blood, at the same time for your healing process, because the more oxygen reaches to the body, more nutrients will be there, more toxins would be removed, and your healing will be better. Hence, it's very important that you practice gentle deep breathing exercise not only before surgery but after surgery. There are many methods of doing it. Even though if you have gone through a lung surgery, let's say for example, or even a breast cancer surgery, gentle breathing exercises can help you a lot to recover better. Now, when I say gentle breathing exercise, here I mean by diaphragmatic breathing. Now, most of the time we do a lot of shallow breathing, where you breathe in and your chest comes up and you breathe out, the chest goes down. On contrary, in diaphragmatic breathing, what happens is when you breathe in, the abdominals come out, or else your abdominal puffs up, and when you breathe out, the abdominal shrinks, right? That's the diaphragmatic type of breathing, and that's what you are supposed to do before surgery and even after surgery. So when you are lying in the bed on your hospital, just out of the surgery, your anesthesia effect is gone. The best thing that you can do for yourself is to do this gentle deep breathing exercise. You don't need anybody's support in doing that. Just lie down, close your eyes, focus on your breath, see how your tummy moves up when you breathe in and how your tummy goes down when you breathe out. When you will be practicing this in a constant basis, you will see a very good improvement in your well-being. You will see a faster healing process. There will be less cough accumulation that will happen, that could happen post-surgically, right? And your overall health and well-being will be very fastly recovered. So that's my number one tip. The second thing that you need to do when you are recovering post surgery is to mobilize. Now, here what happens is there are two types of mobility. One is called your bed mobility, how much movements you're doing on the bed itself, and another is your physical mobility, where you are getting out of the bed and walking around or sitting up and sitting down, right? Now, here your doctor basically determines what day you should be able to stand up and start your walking, right? Or else at what stage you are allowed to move and not allowed to move. Okay, so it's very important to have a discussion with your doctor and understand how much movements are allowed for you and what are the movements that are not allowed for you. It's very important to know that depending on the surgery that you have gone through. Now, apart from that, what you can do at this stage in time is when you are lying down, okay, you can do some gentle pumping movements of your legs. So simple leg up and down movements you can do. You can move your toes. You can take a squeeze ball in your hand and squeeze that ball in your hand, right? These simple activities will make sure that the pumping of the blood is going right. There's no pooling of the blood happening, which leads to a lot of lymphedema or else edema. Or many people experience that their legs become swollen when they are undergoing surgery, or their hands become swollen after surgery, right? So that happens due to lack of movement, because you are on bed, you are not moving, right? So this is an alternative way with which you can increase the pumping action in your body. So that's my second tip. The third tip that you can do is you can move the joints which are not involved. For example, let's say you had a breast cancer surgery, lymphedema, the axillary glands are removed, the axillary lymph nodes are removed, okay, and there is a surgery that has happened, okay. So your affected side is, for example, right side, but nothing has happened to your left side, okay. And if you feel that the left side is free to move, please move your left shoulder up and down. Definitely it's important to take advice from the doctor and then start, but the idea is to move the limbs or the joints which are not involved in surgery. Always when you are doing these separate movements, you are keeping your body active. Again, here also you have to be careful of one thing. Don't stretch yourself, listen to your body and do the gentle movements in a very pain-free range. You don't need to even push your body much, okay. The idea is to just create movements here. The fourth thing that I would like to talk about is, let's say you are discharged from the hospital, you've reached back home, right? Now, many a times people are scared of touching the scars, right? Which is very important. The scar should not be disturbed, at least till the point it is healed well. You will be going for your repeated hospital visits. But having said that, it is important to mobilize the skin around that area. So let's say if here you have a scar, you don't need to mobilize this, but at least you can do some mobility or some massage on the back side of the neck, which is not directly linked to it. What it will do is it will mobilize the skin tissue, it will mobilize the fascia, okay, and it will maintain a good blood circulation. Why it is important? Because your fascia, because of this spasms and all, gets tight, okay, can lead to future pains and aches. It's very common to get neck pain, shoulder pain, back pain post surgery, right? Why it is happening? Because these muscles are tight enough, because they are not moving well. Hence it's important to move. And My fifth tip and the last tip here that I would like to give you is, once your scar is healed, once your doctor has said that yes, the scar is healed, please start mobilizing your scar. Touch that scar. It's okay to touch that scar, and make sure that you massage that scar. Let's say this is my neck and here I've got scar. Just massage it on a regular basis, otherwise it will form a very tight knot kind of a structure, which will be very painful in future and can give you a lot of neck pains. Hence, taking care of these things, small things, plays a very crucial role. And here I will end this video with one most important last tip, is to start walking as soon as possible. Just take the permission from the doctor when you are allowed to walk. Nowadays, most of the studies support early mobilization, early mobility. It is not at all encouraged to keep the patient on bed for a long period of time. Even though you have difficulty, just do a sit to stand activity. Just stand at one place and just march with small steps. Don't push yourself, okay? Don't force yourself, but just try to be as mobile as possible as soon as possible, because that is going to improve your recovery process drastically. So friends, these were my top 5 tips. To summarize, I'll tell it again. Number 1 is do deep breathing exercise. Prefer diaphragmatic breathing exercise. Number 2, move your limbs which are not involved in your overall surgery thing. Number 3, mobilize the skin as well, which is surrounding this area. Number 4, do ankle toe movements and pumping hand action to maintain good circulation. And number 5 is to mobilize the scar thing. And the last was the number 6th one, which was to start early mobility as soon as possible. So these were the tips for any post-surgical patient who is either going through surgery or is recovering from surgery. I hope you found these tips helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to our YouTube channel HealthQ. I would also like to tell that we have a panel of expert physiotherapists in different domain of physiotherapy. And one domain of physiotherapy that very deeply takes care of post-surgical cases is cardiopulmonary physiotherapist. These physiotherapists are medically trained, are specially trained in managing post-surgical scenarios. They can provide you some important tips, tricks and exercises with which you can recover to your day-to-day life very soon. Just these doctors are available to consult with you at click of the button. So please visit our website www.healthqrehab.com and book an appointment with our specialist. On that note, I'll see you in another video. Thank you.